Welcome to the Vet Med Wellness and Leadership Podcast, where we discuss central challenges vet med leaders face, such as burnout, stress, and difficult interactions with clients and staff, just to name a few. In each episode, you will hear about actionable solutions that you can apply to your practice and invitations to connect with fellow leaders who are passionate about improving the wellness of the vet med profession. By subscribing, liking, commenting, or sharing this podcast, you are helping more veterinary professionals find the resources shared in these episodes. Thank you in advance for listening and supporting this show. I hope you enjoy it.
Hey everybody, Crystal Stokes here, and joining me today is Dr. Jim Ward, who is a veterinarian, entrepreneur, writer, teacher, and the founding pathologist and CEO of Specialty VetPath in Seattle, Washington. In her spare time, when she's not running a company, she spends her time with her family's property, working alongside her family to secure the legacy of conservation and to balance the stewardship of wild spaces and a productive, regenerative farming property. That is a mouthful, but it's super cool and very close to my heart. Growing up, I did my bachelor's degree in wildlife conservation, and I grew up a farm kid that was not regenerative. And so you got to see what that was like. So I think it's really nice that you're doing that when you're not busy running a company. So, Dr. Ward, thanks so much for being on with us today. I know you're very busy, and I'm excited to talk about your story.
Well, thank you. It's great to be here.
Awesome. Well, let's go back in time a little bit. So the point of our podcast today is to learn more about Specialty VetPath, but I think it's very unique, and many people in the vet med space will be intrigued by this. Let's just start off before Specialty VetPath existed. What were you up to that may have led you to the idea of creating this?
Oh boy. I mean, how far back shall we go? I was definitely, like so many people who become veterinarians, I was a child who at one point in my childhood was absolutely, even if I wasn't sure I was going to be a veterinarian, everybody else around me was. I was that kid who was just always finding the sick and the injured animals and helping them however I could. I grew up in a rural area of Hawaii on the windward side of Oahu. And so my patients, in addition to dogs and cats, included a lot of lizards, birds, toads. It is just, frequently they were animals that had been injured by, not just by the various things that happen to animals with humans around, but also we had cats, and there were feral cats. And so there would be cat saved from cat, and then animal dies. And so I performed a lot of necropsies early on, which fortunately my family didn't think was super weird, or maybe they did, but they didn't discourage it, and they didn't despair and think I was clearly going to become a psychopath. But none of us knew what a pathologist was, so nobody said, "Hey, Jen, I think you're going to be a pathologist." People still figured that I would be a veterinarian, and I'm not really sure where I just knew that I was intensely curious about why these animals died and what I could learn from them. And somehow I knew that a way to learn something was to look inside. I didn't know what I was seeing at the time, but it was definitely a big part of how I engaged in my passion of trying to help animals.
Wow.
And I remember times early on with my dad. My dad was an English literature professor, so it was not something that he knew about innately. But he grew up on a farm as well and had done his fair share of butchering of things. So there were times where he would poke around in the little body of the lizard with me and try to help me identify the different organs. And so fast forward, I did not end up becoming a veterinarian directly. I didn't follow the direct path. I went to college. I ended up really not thriving in the science classes. I took a few initially. I didn't have a good science background in high school, and I gravitated to my other passion, which was literature and writing. And I got a bachelor's degree in English literature with a creative writing concentration. And embarked off in the world to have adventures and be a writer. And then somewhere along the way, a combination of, so I ended up in grad school eventually in English literature. And I had an old English sheepdog, and he had severe allergies. And so in the process of taking him to vet after vet to try to get help, and this was in, what year was this? This was way back in, I guess, 95, 94, somewhere back there. So there were not, it was pre the spot on treatment for fleas, and he was allergic to fleas. There wasn't any dermatologist on the island at the time. Eventually, before it was all said and done, there was one, and got an allergy testing and learned that he was allergic to things that I couldn't possibly be protecting him from. Sugarcane. I had moved to Honolulu to try to avoid the fleas, and it turns out he was allergic to tobacco, and everywhere we walked, there were cigarette butts. So it was definitely just a huge struggle with his allergies. He was periodically miserable, and I went through the same kind of vet shopping that a lot of frustrated owners have done, and probably more so in the past, with dermatology being a much more developed field and more veterinarians, even in general practice, better trained in dermatology and with more tools. But he would get these cortisone shots and he would do great. And I would think, okay, this is what he needs. I'd take him back for another of those shots. And then I finally had a vet tell me we couldn't do any more shots. And I was like, well, why not? They're the only thing that makes him feel better. And so this started me on this path of trying to learn and understand what was going on and trying to help Abraham. And then it was, bigger than that. It was just really trying to understand the immune system. A small project. And so that was part of what was going on. And then I was just also really feeling like I wasn't disliking my studies as a grad student, but I really wasn't on fire about them. And I'm the kind of person that really wants to be on fire about what I'm doing. I wanted to find something that would make me feel just really passionate and like I would do it no matter what. It didn't, if I had all the excess of money that I, didn't need to work for money, I would still just do it every day for the love of it and because it's important. And so I was just looking around trying to find my way. And then I was traveling in Africa with my sister, and we were randomly happened to be in a bar and met these two veterinary pathologists who were there working on an outbreak. They were studying, trying to figure out what was killing lions in the Serengeti. And so just talking to them, and they told me we're veterinary pathologists. Yeah, well, what is that? What do you do? And they told me what they did. And I was just mind blown. I'm just that is what I wanted to be all my life. I just actually didn't know it existed. And so that started me on, that's got really redirected into veterinary medicine. Yeah. I'd never had an idea that it could be anything other than what I experienced growing up, both taking my animals to the vet, and I worked in a vet clinic, small general practice. It just I had no concept of all these other things that veterinarians could do.
Let's pause there for a second, because this is part of the motivation of having you on the podcast, is that so often I think people in veterinary medicine, even though they've gotten down the track of being in vet school or graduating as a new graduate, now they're in GP, and still may not realize the opportunities that are available to them in veterinary medicine. And we often hear, with the work that we do at Full Circle, we're often listening to people who are stressed and struggling in some fashion within their job. And sometimes you can tell that there's an aspect of role fit that is not working for them, being in a typical GP clinic where there's a lot of interaction with clients, a very social atmosphere, quite busy, maybe lacking the depth that they might enjoy, and that something like pathology might be much, much more interesting to them, provide them with the depth they want, provide them with more of the deep thinking, slower spaces, ability to really investigate something more fully. So I think that it'd be helpful if you could describe what does the career of a pathologist look like, and then start getting into the creation of this company and how that happens. Let's start with, what does a veterinary pathologist's normal day look like?
So first of all, just like with veterinary medicine, there's all these different things you can do. And then you go through this like little narrowing and you become a veterinary pathologist or another specialist. And there's still all these different things that you can do. So I'll describe what a day for me as a diagnostic pathologist, and as someone who's kind of created a way of practicing that's a little bit different from, well, it's probably a lot different, but has still very common threads with what diagnostic pathologists in a larger company would do. So a big part of what a pathologist does is, in the very general sense, our job is to understand, know everything about how disease develops and progresses, what the pathogenesis of disease is, what the underlying cause is, and then how that manifests at the macroscopic level that you can see grossly and clinically, at the microscopic level to see with a microscopic, evaluation, and then also ultrastructural, cellular, biochemical, just to understand all of the ways that disease manifests and impacts the patient. And the really critically important part of that is that it's the clinical relevance of it. If you have disease, but it's not having any negative impact on a patient, is it really disease? So understanding what the impact of it on the animal that is experiencing the disease, and then that helps to inform the understanding of how to stop it, treat it, prevent it. So it's integral to the practice of medicine. And then there's experimental pathology, and there's, pathologists who work in, pharmaceutical and in basic research. But this is where I've taken that to apply in my practice as a diagnostic pathologist. What I do is I get samples from veterinarians who have patients with either a visible lesion or an other manifestation of disease that results in then taking a biopsy to try to understand what's going on, get a diagnosis, and know how to treat. And those samples come to my lab. My techs under my direction do the processing and prepare the samples, and then I and the other pathologists that I work with review them under the microscope, make an interpretation, write a report, send it to our clients. And that's how they know what their next steps need to be, and what they need to, there's information about prognosis, or, knowing the diagnosis, and the veterinarian themselves have their own practice in pathology, really, because we all in medicine practice pathology. We have to understand pathology at some level to be able to practice medicine. There would be no need for medicine if there weren't pathology. So it really
exactly. All right. So now let's get into the creation of specialty VetPath. You're working. I'm assuming you're working independently first, and then you saw a need for something bigger. So let's talk about that. Like, what led you to start this, and how did you start it?
So I think I started thinking about the possibility of having my own pathology practice fairly early on. I did work in a human small private pathology lab while I was doing my pre-vet courses, because I had to do like a complete shift from grad school to take all the pre-vet courses. And while I was doing that, get some clinical experience, I also got some research experience and some lab experience. And I saw a way of really integrated practice with the pathologist and the clinicians that I was surprised to not see replicated once I got to vet school. And so that started to trouble me. But I also thought, well, okay, that maybe that's just this one, I'm at vet school. I went to WSU, but, I thought that doesn't necessarily mean this is how it is everywhere. But then when I went and spent some time with veterinary pathologists, I did start to increasingly get the impression that we weren't talking to the clinicians as much as maybe I thought that we would be. And I think that just varies for sure. But the more cases your caseload requires you to read in a given day, the less time you're going to have to talk to clinicians. And then when I spent my time in residency, it was also just the case that even within that hospital, there was less integration of the anatomic pathologists with all of the clinical house officers. Mm-hmm. The clinical pathologists were there in the hospital and interacting, but the anatomics we were just kind of out at the periphery. And I wanted to be right there involved, talking with the clinicians and being part of the team that helped make sure that things went the best that they could go for the patient. So that's really what led me to make, I couldn't find it anywhere where that's how it was being done. So I made it myself.
You built it yourself. And it's so cool that you had earlier experiences in human healthcare, but also led to this idea of it could be different. It could be better. So let's explain that to listeners who've never heard of Specialty VetPath. What is Specialty VetPath?
Well, Specialty VetPath is a pathology laboratory. We do diagnostic pathology. So our clients are veterinarians who send us samples from their patients to provide with an interpretation and a diagnosis and help them guide the management of that case with that information. We also have a collaborative research department where we provide a similar, very sort of integrated relationship-based support for researchers who are not pathologists, who are doing scientific studies that in any way use animals, so that the interpretation of the results is they're able to access the expertise of someone who's trained to make an accurate interpretation and get the most information and most accurate data out of that study possible. And including in just the very elements of the design of it. So we really like to get involved with someone before they ever design a study and before they process any tissues, rather than after all that's happened. And then they come and we're like, yeah, I'm not really sure we can do much with this, because that tragically happens not uncommonly. So we can help from the very beginning and make sure that everyone's resources and every life that's involved in that study is delivering maximum value.
Wonderful. So you kind of have two different client pools. One is on the research side, and the other would be veterinarians and clinics, hospitals that are sending you these tissue samples. So let's have
one more branch. Mm-hmm. So I think I've been teased, and I've teased myself because I made a very specific decision not to go into academia. Mm-hmm. After thinking that was where I was headed. When I first started vet school, and I was going to be a pathologist, I was going to get a PhD, and I was going to have a lab, and I was going to work at a vet school and teach and do research. And that's not what I did. So, but I have sort of tried to create, apparently, what they call the triple threat of an academic pathologist outside where we do our diagnostics and we do research and we also do teaching. So we have a teaching section. It's really a education and community building called the Alliance. And then that's the third piece of our business.
Wonderful. So let's talk about the first section of it, which is the veterinary companies who would send over their tissue samples. You kind of give us a little walkthrough. Can you just do it one more time, just so we understand? If I was a veterinarian listening and I was thinking of using your services, how would I set that up? How does it start?
So you contact the lab, and a lot of people will just contact us through our website, send an initial email inquiry, and that generates a response by email and also a phone call or an offer to set up a phone meeting where we can just sort of explain how we approach working together, share our pricing, and kind of go through and explain what the different testing categories, sending in biopsies for histopathology is like, on the one hand, you'd think it would just be the same wherever you send it, but it's really like there's so much variation in the type of sample that can be sent in, and it's really hard to kind of come up with a way of categorizing them so that they optimally move through the workflow of the lab. Some need to go to a tech who's at the really highest level of complexity training and qualified to handle a complex maxillectomy. Sometimes we work with a lot of surgeons, and so we'll get cases that are almost more like facectomies. And the margin evaluation is very critical. So we're getting these samples and orienting, describing, inking, sectioning, taking the samples that are going to go through the processing and end up being sectioned and put on a slide for the pathologist to evaluate. So I digress. I find this stuff really cool. So
I know you can just but I'm following you just fine. So it's like the initial part is just establishing the connection, send the email, get on a call, understand the process, submit the sample, just build that relationship with the veterinarian and their hospital. So now you have this open door that's started. From a money standpoint, is the client usually charged, or does this charge go through the hospital and they charge the client?
We charge the hospital and they charge the client.
Got it. That makes it easy. And then I know that a big part of what you enjoy about this, you had mentioned on our previous call, was really that aspect of the relationship with the client and the team members. Like now your team is a part of their team. So speak a little bit more about that, because I'm imagining if I were a veterinarian, how good it would feel to know that this whole company has my back. That it's not just me trying to figure it out and feeling like I'm on an island. So talk about that relationship that's so important to you.
Well, for one thing, it can just absolutely make or break how well I can do my job, how well a pathologist can do our job, is if we have the right information. And rather than being in this, like there's a big sort of echo chamber where pathologists get together and talk about how we just don't get the right information. We don't get the clinical information we need. We wring our hands, we tear our hair. And so I just thought, well, I think we can get it. We just have to do a better job of explaining what we need and why we need it. And so if I have a case that's been submitted and I don't have what I need, I just call. Or if I've established that email is a better way to get in touch with someone, I can email them. And I started doing that just early on in my practice. And it has been, it's now like when I onboard a new pathologist, that's a big part of what I sort of mentor them in, is when you don't have enough information, don't just make do. Don't just guess. Don't be frustrated, but just sign out the case anyway. Call them, email them, establish the relationships. And you'll find the histories are going to get better and better. And they do. And in fact, when people come and work for me, or I've just had, people come do locums and fill in, and they're like, the histories that you get are so good. You have really good clients. I'm like, yeah, I do. And, I think in part, I've attracted really high-level people, but I've also worked really hard to train them because it's just not something that people get trained in to the degree that we need them to be in vet school to be able to maximally utilize their pathologist. And we're not trained to have a relationship with the pathologist. And so even just the idea that they can call me was really new to them. And sometimes they'd just have their tech call my tech and they'd, try to not disturb me, or they'd call and talk to my tech. I'm like, oh no, you don't need to disturb the pathologist. And they would tell us like, oh no, she'll want to be disturbed. She'll want to talk to you, because I do. And some of my best friends in this part of my life are people that I met who initially I met them because they sent me a biopsy. And so it's really, it's great. And my staff, one of my longest tenured staff people, who's an absolutely fantastic customer service person. And he also happens to be my brother, which is really cool because we used to pull around our little red wagon together and do our vet work.
Good, so good.
But I just love to listen to him on the phone because he knows the people at the clinics. He knows the techs. He knows their front desk people. And you can just imagine how, just listening to him on the phone, I just feel so good about how we are holding and supporting our clients, because he knows them. He takes pleasure in helping them. And I know that when they call, they don't get, sometimes we have people cycle through who aren't as great on the phone as him. And so that's always like, that's the bar we try to set. We're like, even if you don't know exactly what to say to them, be happy to talk to them, be nice, be friendly. If you can't be better than voicemail, let it go to voice.
Good rule. I like that. So I think it's really nice to highlight that the work you're doing, some people can picture pathology as like you just hide away in your hidey hole and you don't talk to people. Not at all. Like some people that are in pathology still love the team relationship, being connected to the bigger picture, and also getting all the information so you can really, really do the best work possible. So I love that. Let's shift gears just for sake of time and just briefly touch on the educational component. So for those who might be interested in learning, like, hey, I think pathology is pretty cool. Tell us more about how that works.
Well, so the Alliance is a membership-based program, sort of optimally at least, but you don't have to be a member to consume. You can purchase a la carte webinars. We have on-demand courses that are part of the Alliance, but you can buy them separately. We have things that are discounted for Alliance members, but we have a whole core of educational material that is included in that membership. We do rounds twice a month. There's a ClinPath focused rounds where it's we call minimum database and cytology rounds. So focusing on the minimum database is your CBC Chem UA. It's focusing on really developing our clinical skills in interpreting the nuances of blood work. There's just so much need for veterinarians to have support in that. The amount of time that a clinical pathologist spends refining their understanding of the pathogenesis and the biochemical processes, and then how they manifest as these analytical results that get spit out of those machines is tremendous. And a lot of times that just doesn't get tapped into because we think of a clinical pathologist as just the person who's going to read your cytologies. They're really good at that, but they have this whole other wealth of knowledge in their heads that they can bring to bear if we can just find a way of getting them more interaction with the clinicians around these challenging cases. So that's what the minimum database rounds is for. And then the cytology is also just to hone your cytology skills. And these are for pathologists and clinicians. for pathology residents, for clinical residents, for anybody who's interested in developing those skills in a non-threatening, laid back, fun, nerdy kind of environment.
Awesome. Like what do you do on Thursday night when you're bored? Sign on.
Right. Exactly. And then we have an anatomic pathology focused where we do grossing rounds. And that is, a lot of it is more for pathologists and pathology techs, but also surgeons, surgery techs, anybody who's curious about how the big piece of tissue that you send in ends up with a diagnosis, anybody who's curious about how we can evaluate the margins on these samples, and also people who want to learn and maximize what their role is, what the responsibilities and actions of the clinician, how that manifests in, it really is a partnership between the clinician and the tech who's doing the processing of the sample and then the pathologist in being able to really get a proper gross evaluation and a proper margin evaluation that informs the diagnosis. So we'd love to have clinicians participating in that, even if they just drop in now and then to kind of open their eyes to that side of things because it's kind of invisible behind the curtain here at the lab. And then we do different types we have our ocular pathology subspecialty rounds, and that's bringing ophthalmologists and pathologists together, and clinicians are also very welcome. You could learn, like if you feel like you need to learn more about eye diseases and how to diagnose and treat them. It's heavy on the diagnosis, less on the treatment, but there are ophthalmologists there to answer those questions. So that's absolutely part of what is covered. I'm starting in December, not December, that's now. I'm starting next month. I'm going to be doing a combined with a dermatologist that we work with who does clinical consults on, like after I've done a dermatopathology evaluation, people can opt to have also her provide just sort of clinical assessment and treatment recommendations. Those have been enormously helpful to general practitioners in areas where they don't have access to a dermatologist to refer to, or if they have a client, even if they feel like the access is there, but the client just won't go on referral, that really opens up a lot of just an avenue to help that they don't otherwise have access to. And we're going to be using those cases. We've been doing it for a few years now, and just kind of covering some cases with follow-up from the clinicians and how that played out. And there's some really interesting, good cases and some very happy outcomes to share. So I'm really looking forward to doing that.
That's great. So you clearly have a lot going on. And I know we're kind of just scratching the surface, just trying to give a broad introduction to what you all do. We're kind of coming down the home stretch on time. So what I'd like to do is tie this up in a nice little bow. For those listening today who are busy people, they can only store about one or two things in their brain. What are a couple of takeaways that you hope people leave here today with?
That pathology is the foundation of medicine, and that I don't mean that just to say that pathologists should be up on this pedestal, because I mean everybody's pathology. We all learn pathology and pathogenesis, and that informs how we practice medicine. And that may be more of a distant memory for some of the clinicians who really, were more focused on medicine and treatment, which is why some of us weirdos went into veterinary medicine specifically to be pathologists. But it's important to all of us. So having a relationship with your pathologist is one of the ways that you can really maximize how you bring that to bear for your patients, not just because you get the pathology from the pathologist, but it helps you develop your pathology and your medicine maximally and help your patient maximally. So that is why I'm so passionate about this type of practice, this engagement with the pathologist and helping other pathologists access this type of practice and helping clinicians access pathologists who are practicing this way. So find one. It'll really make your medicine better.
Are you currently hiring or adding people to your team?
We actually are. We're not hiring pathologists right now, but we are hiring. We're looking for some really great lab techs, and we also are looking for a lab manager. We're looking for a lab manager who has a background as a histotech.
Wow, wonderful. And for people listening today, if they'd like to get in touch, learn more, where should we send them?
You can send them to our website. The website is specialtyvetpath.com, www.specialtyvetpath.com. And you can get in touch with us right there through the website. We've got to contact us. You can check out information about the Alliance. You can sign up to be a member. You don't have to be a client to be an Alliance member, and you don't have to use our pathology services. Whatever. I think that kind of mixed that up, but vice versa. Neither one of them requires the other.
They both run independently. So you could have a client, you be a part of the Alliance, or both, or neither.
Right. Yeah.
Awesome. Well, Dr. Ward, thank you so much for being on with us today. I will put all that in the show notes so people can find it. And it's just been a really interesting topic. I hope those listening today now know a little bit more about how they can engage with pathology, or if they want to go the route of pathology, to realize there are many different ways to put it to use. You have a really interesting story. So thank you.
You're welcome. Thank you.
Thank you for joining me today. I hope that you feel stoked after listening to this episode. And as always, I would love to hear your comments and feedback. Is there a topic that you want to know more about? Please let me know. And thank you again for subscribing and sharing your favorite episodes with others. It really means a lot.